Chris Hensley is a registered representative of Cambridge Investment Research, Inc., a broker-dealer member of FINRA SIPC, investment advisor representative of Cambridge Investment Research Advisors, Inc., a registered investment advisor. Cambridge and Houston First Financial Group are not affiliated.
The Houston Midtown chapter of the Society for Financial Awareness presents Money Matters with your host, Christopher Hensley.
Good morning, everybody. You're listening to Money Matters on KPFT Houston. It's 10 a.m. Have a great show lined up for you today. Very excited. Not long ago, Medicare used to be a relatively simple program that most Americans were more or less automatically enrolled in at age 65. Now, however, the program has become exceedingly complex with different enrollment periods, Medigap and Medicare Advantage plans, in addition to original Medicare Part D drug plans, constantly changing provider networks, convoluted appeals processes, coordination of benefits with employer and retiree plans, and many other variables at play. Making a mistake in any one of these areas, which many Americans, including the affluent and well-educated, all too commonly do, can cost you big money, endless aggravation, and lost chances to get the best health care. Our guest today, Philip Moeller, is a co-author of the New York Times bestselling guide to Social Security, Get What's Yours, and author of the popular Ask Phil Medicare column, which is on PBS. Explains that for 50 million Americans who are 65 and older, how to make the best yearly choices in the rapidly changing Medicare program, just in time for annual open enrollment period. And the new book, Get What's Yours for Medicare, Maximize Your Coverage, Minimize Your Costs, was just released on October 4th. So really, just the beginning of this month, the new book has been released. Very, very excited to have Philip on the show today. Please stay tuned. Keep listening. But if you are a longtime listener, you know that we always reserve the first few minutes of the show to tell you a little bit about who we are, what we're doing, and then also the calendar of events that we have going on. And I wanted to start with that because we do have a few things going on this month. In fact, on October 15th, I will be doing a seminar for employees of University of Texas Healthcare, University of Houston, and Houston Community College on their optional retirement program. And so that is going to be free to the public, free to local Houston educators. That is going to be at the Luskin Branch Public Library at 10 a.m. on October 15th. You can find out more information about that by reaching out to 832-231-9697. And then I also wanted to mention about Houston Money Week, which we are a local partner with. And Houston Money Week, every year in April, we provide financial education classes to low to moderate income, really everybody across Houston, and all of these classes are free and open to the public. We just released the Houston Money Week 2016 Impact Report, and it's got our numbers from last year. Last year, we had 206 events for Houston Money Week. We were able to reach out to over 11,000 Houstonians about financial literacy. So very, very great. The report came out, looks really, really nice. I wanted to encourage people, even though we're here in October and this thing doesn't get kicked off until April of 2017. It seems like very, very far away, but in reality, it builds and builds and builds, and then when we get there, it's over in a flash. So I wanted to encourage people to go out to their website, www.houstonmoneyweek.org. We're always looking for people to host or provide space for their employees. If you're interested in having somebody come out and talk or hosting a Houston Money Week event, you can reach out to them at www.houstonmoneyweek.org. With that, I want to go ahead and get our guest on the air because I wanted to kind of maximize our time here. So let me get Philip on the air here. Philip, are you there?
I am.
Excellent.
Morning.
Excellent. Well, good morning to you. Thank you so much for being on the show today.
My pleasure.
Well, usually I'll start by introducing you to the audience here and sharing your bio with them. Journalist Philip Moeller writes about retirement for Money Magazine and authors the Ask Phil Medicare column for PBS. He has won major business journalism awards for his work and that of the business staffs that he has led, including the prestigious Gerald Loeb Award. He also is a research fellow at the Center on Aging and Work at Boston College and the founder of Insure.com, a leading site for insurance information. He is the co-author of the New York Times best-selling guide to Social Security, Get What's Yours. Philip, thanks once again for being on the air here.
Sure.
Kind of a side note here, as I was one of my favorite books when it comes to Social Security is Get What's Yours, and when it came out, I got it. And then when they passed in the changes in Social Security, I got really sad because I was like, oh no. And when I was researching for when your new book came out this week, I got on the website and I just realized that you guys did an updated version of it. So that means I have to go back and reread it again.
Yeah, we get a lot of calls from readers saying, hey, I bought the first book. Can I get the second one for free? And I said, well, talk to your bookseller because that's not up to us.
That's right. Bookseller. That's how those things work. As soon as something, and then they pass a new law, it's out of our hands. But well, Philip, thank you so much. Might you be able to share a little bit about yourself, maybe outside of the bio, so that listeners can get to know you a little bit better?
Yeah, I'm 70 years old, and I joke that I get my story ideas by looking in the mirror every morning in terms of writing about aging issues. I've been focusing on aging for the better part of a decade. I think it's a really interesting place to write about. I think the rising numbers of retiring baby boomers is really changing the way we think about aging in society. But when we did the Social Security book, I concluded that was really only part of the story, and that Medicare is sort of the second bookend on the bookshelf of retirement, and you really need to understand Social Security and Medicare, and you need to get these programs right in order to have a shot at a successful later life. I sort of am a big believer in paying attention to longevity trends, which is one of the reasons we suggest that people wait till age 70 to take their Social Security, because the benefits are much higher than if you take them earlier. Obviously, circumstances are different for every individual, and there are some people who just need the money and can't wait, and we understand that. But it's also true that some people can't afford to wait, and our feeling is that given the likelihood of people living well into their 80s and 90s, that waiting until 70 to max out those benefits is really crucial. So in approaching Medicare, I found the same thing is true about it as Social Security, which is, these programs have been around a long time. You'd think we'd have them down pat. They'd be really easy to use, pretty basic. You sign up, you get your benefit, end of story. We found that wasn't true with Social Security. It's a very complicated program, and in fact, the same thing is true of Medicare, and Medicare is getting more complicated, not because the government doesn't love us or regulators, but because healthcare is changing, it's getting more sophisticated, and so are the insurance products that have to protect us from some of those expenses. Also, as you probably know, Part D drug plans weren't even around until 2006. Now more than 40 million Americans have Part D drug plans. Medicare Advantage plans have also only been around in their current form since about 2006. They become very popular. A third of all Medicare beneficiaries now have Medicare Advantage plans. That's great, but the result of this is that we have more layers of insurance and more complexity for people to deal with, and that's one of the reasons I did the book, is to do what I could to try to make the topic a little bit more accessible for people. The other thing I'd add before we get into any specific questions is that, getting Medicare is not the end of the story, it's the beginning. If you're 65 when you get it, you may be having Medicare for 20 or 30 more years in your life, and You need to know how to use this product year in and year out. As you noted, Medicare Open Enrollment begins October 15th this year, runs through December 7th. It's a chance for people to change their Medicare coverages. I call it a do-over period, and I really urge people to consider doing a little bit of homework to determine if they can get cheaper and better coverage. Surveys show that people can save hundreds of dollars and improve their coverage. In other words, they get more coverage for less money if they use open enrollment properly and take advantage of it every year.
Well, it's you mentioned complexity. That was the word you used, and I kind of smiled when you said that because here I am, a financial advisor, and after reading your Social Security book, I'm like, oh, and more Medicare issues have bubbled up for my personal practice, but just when I go out and do seminars and that sort of thing, it's like, oh, okay, I understand Medicare, and as I start getting into it, it is super, super complex. When you wrote the book, you share a story right at the beginning about what somebody that was either a CPA or an attorney. Can you share that with us?
Yeah, that would be Phyllis the Attorney. Phyllis was a partner in a big corporate law firm. She kept working till she was 75, which is, again, people don't retire at 65 anymore. And when she got ready to retire, she sat down with her employee benefits person and tried to understand what was going on and got ready to do Medicare. And she was totally unprepared for the complexity of even signing up for Medicare. For example, she didn't know that Medicare sign-ups are handled by Social Security. And in fact, Social Security is administratively responsible for a lot of sort of the Medicare logistics. They handle sign-ups. They handle certainly the payment of Part B premiums are automatically backed out of your Social Security payment. They also handle what are called high-income surcharges, which raise premiums for Medicare Parts B and D for people with incomes above certain levels. She didn't know that. She didn't even know Part D plans existed. She never heard of Medicare Advantage plans. She sort of thought she would be automatically signed up and found there was nothing automatic about the process. Now, Phyllis is a smart lady, and over time, she worked her way through some of these issues. But it's only through the grace of God that she had almost no health care issues and didn't take any expensive medications during her early period on Medicare, because had she done so, she might have been in a world of hurt. So Phyllis was lucky to that extent, but sort of her mantra at the end of the process, she kept saying this when we talked about her situation, she kept saying, "No one told me. No one told me." And that's a truism with Medicare, and if you expect people to tell you, you could be waiting a long time. The thing about Medicare, when you roll off of an employer plan into Medicare, is that you're sort of on your own. Employers made a lot of these basic decisions for you when they selected plans, and you didn't have a lot of control over some of the variables in those plans. That's not true in Medicare. So you're basically your own insurance broker when it comes to Medicare, and there can be numerous products that you can buy. They have wrinkles in them, the things you need to understand. So recognizing that you're on your own is important, and also saying that no one ever told you is not a defense. You need to learn this stuff.
It's not a way to get. You're still expected to make those decisions, and if you make wrong ones, they can actually lead to penalties, and we'll get to that in just a moment here. But when in the book you talk about what you call 3 really big deals when it comes to getting Medicare right, can you tell us about these?
Sure. And part of this is to help people break down this complexity. Because if you look at Medicare as this big ball of stuff, it's just unmanageable. It's too big, it's too complicated. People run away screaming. They don't want to deal with it. So we want to break it down into pieces. So the first of these 3 pieces is make sure you sign up for it at the right time. There are different enrollment periods for Medicare depending on when you need it. If you, again, in Phyllis's case, she didn't need Medicare till she was 75 because when she turned 65, she was still working, and she still had employer insurance. And for people who have employer insurance, in most cases, they don't need to get Medicare. Now, if you work for a firm that has 20 or fewer employees, it's a different story. In those plans, Medicare is required at 65 usually because your employer insurance takes on a backseat role and is the secondary payer. But for most plans, the employer coverage is the primary insurance that you have when you turn 65, and in most cases, you don't need to get Medicare. When you do get Medicare, there are sign-up periods for it, and they can last 7 or 8 months depending on when you sign up. But I wouldn't take all of those months, because if you sign up late during your enrollment window, your coverage may not take effect for several months thereafter, and if you're not careful, you could have a coverage gap, and you don't want to have that because, you know, when you get sick, it's when you're not insured. That's when it seems to happen.
It's Murphy's Law.
You don't want to be unprotected. The other thing is, if you miss one of those enrollment windows, you can pay penalties for the rest of your life. You can pay penalties on your Part B coverage, which covers doctors and outpatient expenses, and they can average 10% a year. You can also pay late enrollment penalties on your Part D drug plan, and they rack up at the rate of 1% a month. So these are percentage penalties based on your premium that you would pay, and again, they can stay in effect for your entire life. And so it's an added charge that nobody needs, and we should make sure we avoid that.
I took some notes here as far as what the kind of the things that stood out is if you sign up late, you could have a coverage gap, and so Murphy's Law happens, you get sick, and the coverage doesn't kick in. And then the other thing you mentioned that was to take note of is that the penalties for late on Part B and Part D, you said 10% a year for Part B, even possibly 1% a year for Part D.
1% a month.
1% a month.
Yeah.
And are these penalties something that they, once you get it going, they'll take back, or does this stay for life?
It's forever.
Ah, okay. So that's a very expensive mistake to make.
And the other thing, keep in mind, this is a wrinkle that affects some people. If you lose your job and your health insurance, you can get temporary insurance through the Cobra Program, which is an acronym that stands for a long name of the law that created it a long time ago. So Cobra can continue your health insurance for 18 or even 36 months. People sometimes think that if they have Cobra, that means they have health insurance and they don't need Medicare, and that's not the case. Employer group insurance is an acceptable alternative to Medicare at age 65, but when you get Cobra, you don't stop the clock on your need to get Medicare. So if you have a Cobra policy and you're 65 and you think you don't need Medicare, you could be really shocked because you may not have any primary health insurance because your Cobra insurer may be within its legal rights to say, hey, we're not the primary insurer for you. We're the secondary insurer because you're Medicare eligible and you should have signed up for Medicare. That's a gotcha that can be very painful for people to experience, and it's just something to watch out for.
That's huge, especially if they think they got coverage through Cobra. They're paying. It's usually very expensive, and then they go to find out that as far as when it comes to Medicare, doesn't count.
Right. Well, let me go into the other two areas when you said what are the three big things.
Yes.
The second big thing is to make sure you get the right kind of Medicare for you, and because it's more complicated, again, it's not plain vanilla anymore. If you like your ice cream analogies, it's Neapolitan, or it's some multi-flavors of ice cream. So one of the basic paths into Medicare is original Medicare, which is Part A for hospital and Part B for doctors and outpatient expenses. Plus you need a Part D drug plan. Plus you might have a Medigap or Medicare supplement plan. That covers a lot of the holes in basic Medicare, and basic Medicare does have holes in it. Part B, in particular, will only pay 80% of covered expenses. You're on the hook for the other 20%. And that can be a lot of money, and there's no annual cap on your exposure with Original Medicare. If you get a Medigap plan, it will provide coverage, that protection for you, and you will be protected from these large out-of-pocket expenses. So that's one pathway into Medicare. The other pathway, which has become increasingly popular, is for people to get a Medicare Advantage plan. Again, Medicare Advantage plans are only about 10 years old. They become very popular and now have about a third of the entire Medicare market. Well, you do a little math, and if you're a brand new product, if you go from 0 to a third, it actually means that you're selling much more than a third of the new policies issued, right? Because you're probably getting 50-60% of the new beneficiaries are going on to Medicare Advantage, and over time, that's why that figure rises to a third of all beneficiaries. So there are about 57 million people who have Medicare this year, either older or disabled people, and again, about a third of them, are approaching 20 million, have Medicare Advantage. In a Medicare Advantage plan, you only deal with a single insurance company for all of your Medicare needs, so it's a little bit easier to handle from an administrative standpoint. And Medicare Advantage plans can offer coverages that some Medicare policies, basic Medicare, doesn't cover. In particular, some Medicare Advantage plans will give you some protection against dental, vision, and hearing needs, which almost all older Americans need special help with, and which basic Medicare doesn't cover. It'll cover surgical procedures, but it won't cover routine care, which is what most of us need in terms of hearing, dental, and vision coverage. Some Medicare Advantage plans cover that. Also, basic Medicare does not cover you when you travel overseas. Some Medicare Advantage plans do, as do some Medigap plans. So that's something that retirees need to know about. Also, Medicare Advantage plans are often less expensive than this other set of choices. And the reason that insurers can offer these added benefits at less cost is because if you join a Medicare Advantage plan, you have to use the care providers in the plan's network. So a Medicare Advantage insurer will create a provider network in your local market and sign up doctors and hospitals. And because it's controlling the network, it can save a lot of money in terms of its costs as compared to Original Medicare. The downside for you as the individual is that you probably have to use the services only of the providers in the plan's network. If you go outside network, you can pay a lot more money for your health care. And in some cases, the insurance doesn't even cover you if you're out of network in certain situations. Also, Medicare Advantage plans tend not to travel well. They're only usually good within your service area. Some plans are providing some workarounds for that. But by and large, a Medicare Advantage plan is only good within the network, within your geographic area. Medicare, basic Medicare, on the other hand, and Medigap lets you use any care provider that accepts Medicare any place in the country, and you're protected and insured wherever you travel within the United States, and you have relative freedom to use whatever care provider you want. And as the book notes in a terribly compelling example, a woman had a Medicare Advantage plan. Her husband became very ill with cancer. She immediately went to one of the top cancer centers in the country to get care for him and was shocked to learn that it wouldn't provide her any care because it was not in her plan's provider network, and she couldn't use that service. She was devastated by that. And I understand that, because if you have a loved one who's sick, you want to move heaven and earth to get them the best care they can, and you may not want to be obstructed by the limitations of your provider network. So these are things that people need to know about, and there are dollar consequences to these choices. Again, you're going to pay more for that package of Original Medicare, Part D, and a Medigap plan. And, of course, a lot of basic Medicare recipients don't get a Medigap plan, and they leave themselves relatively unprotected to some of these higher expenses. Or you can pay less money and get a Medicare Advantage plan. It does have out-of-pocket maximums that protect you, so you are protected from these catastrophic expenses that can hit you in a Part B plan. But that's just the dollar trade-off you have to be aware of. So the third thing you have to be aware of is once you've figured out which plans are good for you and you have your coverage in place, that's just the beginning of the process, because then you have to use your Medicare. You have to understand what Medicare covers and what it doesn't. And, there's some big gaps besides just the Part B gap. Medicare doesn't cover long-term care. Neither does Medigap or Medicare Advantage. Custodial long-term care, which upwards of 60 to 70% of older Americans are going to need at some point in their life, is not covered by those products. There is private long-term care insurance, but it's expensive. Very few people have it, and it's been raising rates lately because it's run into a lot of underwriting problems. The default long-term care insurer in this country is called Medicaid, but the only way you can qualify for Medicaid is to literally spend down most of your assets. So you have to be aware that Medicare doesn't cover long-term care, and you just need to understand what is and isn't covered, and that's, of course, something that I spend a lot of time on in the book.
And if you're just joining us, we're talking about the new book, Get What's Yours for Medicare, with author Philip Moeller. And you can, this is very complex because I have a whole sheet of questions here, and we just are very kind of tipping the iceberg. So I would encourage people to get a copy of the book. Since I got it, it has been a resource on decoding the complex what Medicare is out there. We've got just a few moments before the end of the show, and I thought it might be fun to kind of shift, because what we've been talking about is is really individual questions about Medicare, but we are in the middle of an election year right now, and I thought it would be nice to ask you kind of, what do you think when it comes to Social Security and Medicare, what would a Clinton or a Trump in office look like for Social Security and Medicare?
Sure. Well, I'll say right away, I don't think we know what a Trump would look like in office. I'm not joking around. He's been very light on policy specifics. He's basically said, I'm not going to reduce any of these senior benefits. So that's a distinct thing he said. On the other hand, he also said he's going to cut taxes for people, and I don't see how the two can mix. In other words, both of these programs are under a lot of financial stress. Social Security Trust Fund is running out of money. The Medicare Hospital Trust Fund is running out of money. The rest of Medicare, which is Part B and the drug plans, they're not funded at all, and they get funded every year by deficit spending out of Washington to the tune of about $1/3 trillion. So we can't afford to continue on these trajectories. So in a Trump White House, it's just not clear to me what would happen. In a Clinton White House, by comparison, Secretary Clinton has laid out a fairly detailed agenda of what she would do with various programs, including senior benefit programs. By and large, she wants to actually expand Social Security somewhat, and she certainly wants to expand Medicare, including perhaps providing a Medicare-like product for people who are younger than age 65. There's a lot of problems with the Affordable Care Act exchanges. Some people think that a Medicare-like product would be a cost-effective alternative for people within those exchanges, and that could be a big debate in Washington. Having said that, her fiscal plans are, again, a little bit more spelled out, and taxes would not increase as much, I think, under a Clinton administration as some people think they would have to with Trump if he wants to honor all his other promises. He basically says, no, we can do all this and the economy will grow. Most economists don't see it that way. But in the case of Clinton, I think the issue for your listeners is that in a Clinton White House, I think wealthier people will be asked to pay higher share of their senior benefit programs than is the case. Wealthier Americans already are paying relatively more for Medicare, and I think in the Social Security space, many proposals are focused on the fact that wealthier Americans probably need to be asked to pay more of their income.
Thanks for listening to today's episode of Money Matters Podcast. If you enjoyed the show, visit us on the web at www.moneymatterspodcast.com. Drop us a line on SpeakPipe on the right-hand corner. It will receive any voicemails, questions, thoughts, concerns that you have about the show. In addition to this, we recently launched a Patreon campaign. Click on the Donate Now tab to hit the tip jar and find out what Patreon's campaign is all about.